All right, so I wrote Good Fat is Good for Women, which is for women, but all women, and also men like reading it. And now I just published, or as of tomorrow, it'll be out, Good Fat is Good for Girls, Puberty and Adolescence. And I have two daughters. I have three children, and two of them are female, and they all went through adolescence. So I was very much, well, I've known this for a long time, but so many of their friends are on antidepressants and they don't eat meat. So I kind of put the two together, and I wanted to show women and younger women and the mothers of younger women how important, and also boys, they experience puberty as well, but how to address the health issues that are associated with puberty and adolescence, just as there are health issues associated with menopause, which is, Good Fat is Good for Women. Menopause is addressing those supposed health issues. Absolutely, the health issues are real, but what are they caused by? They are more and more common. Mm-hmm. That is the issue. More and more prevalent. Rates are higher and higher, and that's what I'm addressing. So what are the treatment? The treatment is more hormones because it's associated with a hormonal imbalance. Well, absolutely. But I also call, just like I've called breast cysts, goiter of the breast, endometriosis and PCOS, endometriosis would be goiter of the uterus, and PCOS could be goiter of the ovaries. These are tissues that can very easily become hyperplastic. So what are those tissues looking for? They're looking for iodine. They're looking for balanced blood sugar. They're looking for a balanced endocrine system. So if the endocrine system is not balanced, the tissue will respond trying to get more of what it needs, and that is hyperplastic. I've noticed that most of my patients can link their current health issues in their 30s, 40s, 50s, 60s, 70s to their adolescence. And that's one of, going into, so when you start researching something, and it started with a personal interest, I have children, I was an adolescent too, obviously, but then I did so much research and I have many patients who shared this with me. So I looked into it a little bit, more deeply. I did a deep dive into it, just like I did into the book about menopause. I mean, medications, what do? They suppress function. I mean, if you have an acute injury, then you need medication because you have to treat that. They have to sew your leg back on. They have to give you benzodiazepines that when they sew your leg back on, you don't go into shock, because any kind of incision in the body will cause you to go into shock. So they have to give you things to mediate that response, basically a stress response. But a health issue, other than a chronic health issue, is not due to imbalance. It's not due to the absence of the medication. So we have to figure out, as you always say, we have to go to the root cause, and the root cause is not the absence of that medication.